How is adenocarcinoma lung cancer diagnosed by biopsy? When it comes to diagnosing adenocarcinoma lung cancer, a biopsy is a crucial step. Adenocarcinoma is a common type of non-small cell lung cancer. The biopsy process involves obtaining a tissue sample from the lung or nearby lymph nodes. This sample is then examined under a microscope by a pathologist. The biopsy not only confirms the presence of cancer cells, but also identifies the specific type of lung cancer and allows for further molecular testing to guide treatment options. The process of obtaining a tissue sample can happen in several ways. One method is bronchoscopy. In this procedure, a thin, flexible tube with a camera is inserted through the mouth or nose into the lungs. Special tools can then pass through this tube to collect tissue samples from areas that look suspicious or from lymph nodes. Another method is a needle biopsy, which can be either fine needle aspiration or core needle biopsy. This technique uses imaging techniques like a computed tomography scan or ultrasound to guide a needle through the chest while into the lung to extract a small tissue sample. There is also a specialized technique called endobronchial ultrasound-guided transbronchial needle aspiration. This combines bronchoscopy with ultrasound to guide the needle biopsy of lymph nodes or masses that are near the airways. In some cases, a surgical biopsy may be necessary. This could involve more invasive procedures like mediastinoscopy or thoracoscopy to obtain larger tissue samples. Once the tissue is collected, it is sent to a laboratory for examination. A pathologist will look at the tissue under a microscope to identify cancer cells and determine the type of cancer. For adenocarcinoma, specific markers such as thyroid transcription factor 1 and mucin stains are used to distinguish it from other types of lung cancer. Molecular testing is often performed on the biopsy tissue as well. This testing can detect genetic mutations, such as epidermal growth factor receptor mutations or anaplastic lymphoma kinase rearrangements. These results can significantly influence treatment decisions. If there is fluid present around the lungs, a procedure called thoracentesis may be performed. This involves collecting fluid for cytological analysis to check for cancer cells. Overall, the biopsy process is essential for confirming adenocarcinoma, staging the cancer, and planning personalized treatment. While a biopsy provides a snapshot of the tumor, it may not capture all the tumor's characteristics. Sometimes, repeat biopsies or complementary tests like liquid biopsies are used in clinical practice. Biopsy remains the gold standard for diagnosing lung adenocarcinoma. It combines minimally invasive techniques with advanced pathological and molecular analyses to ensure accurate diagnosis and optimal patient care. Always consult with specialized healthcare professionals for evaluation and biopsy procedures.